grateful for such a nice introduction. I think I just do a little job like humble, and I think I think we have a time bit short, so I will go a bit more quicker. Obviously, with the Three Meem Foundation, we've been have a humble start. We started our work in 2019, and since then we built up on the things. And our main drive behind our work is a passion for helping the community. And our core principles are devotion, compassion, humanity. And we drive our work not randomly. Being working in a health profession, we learned to organize things. So all of our programs are evidence-based, and we look from the feedback from the community, and whatever they are saying and whatever their needs is, this is how we arranged our activities. And our main focus is youth and the women activities. And we have a range of flagship programs, and we work on the community work from health and well-being, mental health. We take a crowd, and we started active one-to-one sessions. One of my colleagues will be going to speak a bit more on. We working on youth education and sports and giving them healthy activities, and similarly for women and child activities. And with the pandemic, we have unprecedented challenging times and difficult times, which we have changed our way of working. And we all familiar with now going on the Zoom, Skype, and different online media, which I especially didn't really much of experience, but certainly we learned from that. And we work for vulnerable staff, and with the self-harvesting members in the community, we raised a food draw, food banks, and we supported NHS with COVID awareness group and the Corona Health group. And we promoted the census in 2021. And for the epidemic with this COVID-19 we come across, we set up from the Three Meem Corona Health group for the community. We want to provide them the accurate information, and also we get the support from the volunteers to arrange to help these people in need. And some of the groups' aim is providing community support who are more at the risk from the virus, and they can directly text us or ring us, and we have a panel of doctors, pharmacists, and nurses to help them out, to guide them, and this is what we're doing. We were working in the community based on the Sale West hub, from where we deliver and help in partnership with the Traffic Council. And we deliver the food and the medicines, picking up the prescriptions. So this is all what we have done with the support to the Traffic Council, and obviously they appreciated our work. But the important thing was we also helping directly with the community in the different groups to provide the right sort of information. And in these difficult times, we didn't forget our NHS frontline staff who put their lives at risk in this pandemic to help us. So as a support and as appreciation, we did the fundraising, and we raised more than £1,000 from our community. So this was not the only front. We tried to help and reach to the community, and when I think some people from Office of National Statistics, obviously we were working in a community approach us, we gave them a full support. We run the campaign in different languages as well, and we printed in our newsletter this campaign to help them timely finish this task. And not only, we also give the support to the people who are finding difficulty in filling the forms, which we were proud of. Now our flagship program is health and well-being, which we know from the evidence that our community have a special need in terms that they have the heart diseases and diabetes, which are very common, and particularly we had a greater impact for the COVID-19 to our community as well. We have the issues like we know from the evidence from the papers that there is a delay in seeking the medical help, and particularly in the cancers. So we want to make them aware. And the other issue obviously our community face also, they are not separate, and drugs and alcohol abuse also exist, which we're trying to make awareness a bit more. We have specialist healthcare professionals who help us to deliver these workshops, webinars, and we started since October 2019, and we are doing regularly monthly programs. Some are women focused, and we cover a range of the health topics. And not only this, we also improve their physical activity, and we arrange the range of the physical activity options. And one of the two which are our regular activity is the men walking group, and for the females they are also a walking group. In fact, with the walking group, our local GP surgeries approach us, and they are sending the referrals for these walking groups to join us, and we happily, like a multi-ethnic and background, getting everybody involved. The other range of activities of the topics is just awareness of the cancer. We felt the responsibility of the COVID-19, and in fact we were the first one who ran this COVID-19 talk and the workshop to make them aware of all these possibilities. And our GP, Dr. Amar Hanan, he presented this talk, which was even welcomed by the Royal College of GPs and approached us to deliver the similar talk. So this was eventually before the lockdown, and subsequently we run when the COVID-19 vaccine arrived, so we were on the forefront to help our community to go a bit more in detail and help them out. And we run the different programs, and we work with the collaboration with British Islamic Medical Association, and we arranged a group of panels which include the virologist, immunologist, and some specialists in trial to give them some confidence about the vaccine. And in fact, I have put my own photographs when I had a vaccine, when I asked the nurse to take a picture, they're laughing, why you want to take a picture? So I said, well, I have to reassure my community really. So I've displayed in our workshops as well. So the whole idea is to give them a full confidence that this is safe and be a part of the community. So our programs were really welcomed, and we were approached even by BBC, who after our efforts of our vaccine program, our health talks were broadcast on the Northwest BBC TV, and I given the interview for that to promote our community to come across this one. And we felt that to reach to our community, we did it in Urdu language, which was covered by various Urdu channels. And we not only stopped there, we used the power of the social media, and we done the campaign both in English and in Urdu they have a lot of myths coming around the vaccine and even COVID-19. So dispel these myths, we come around and we run a really campaign on the media to explain all these myths which are coming and circulating to coming on. And we also put it in the post in our Three Meems newsletter about this vaccine safety, and people encouraged to come in. So we do realize there is a burden of mental health issues, but it was even more important to address this in COVID-19. And for the mental health, we have a volunteer, Dr. Zikriya Goga, who was leading this talk on medical health initiative, mental health initiative. So I will ask Dr. Zikriya Goga to come and say a few words about mental health initiative.